A quarantine is a restriction on the movement of people, animals and goods which is intended to prevent the spread of disease or pests. It is often used in connection to disease and illness, preventing the movement of those who may have been exposed to a communicable disease, yet do not have a confirmed medical diagnosis. It is distinct from medical isolation, in which those confirmed to be infected with a communicable disease are isolated from the healthy population. Quarantine considerations are often one aspect of border control. The concept of quarantine has been known since biblical times and is known to have been practiced through history in various places. Notable quarantines in modern history include the village of Iam in 1665 during the bubonic plague outbreak in England, East Samoa during the 1918 flu pandemic, the diphtheria outbreak during the 1925 serum run to Nome, the 1972 Yugoslav smallpox outbreak, and extensive quarantines applied throughout the world during the COVID-19 pandemic since 2020. Ethical and practical considerations need to be considered when applying quarantine to people. Practice differs from country to country. In some countries, quarantine is just one of many measures governed by legislation relating to the broader concept of biosecurity. For example, Australian biosecurity is governed by the Single Overarching Biosecurity Act 2015. The word quarantine comes from quarantena, meaning 40 days, used in the Venetian language in the 14th and 15th centuries. The word is designated in the period during which all ships were required to be isolated before passengers and crew could go ashore during the Black Death Plague. The quarantena followed the Trentino, or 30-day isolation, period, first imposed in 1347 in the Republic of Ragusa, Dalmatia. Merriam-Webster gives various meanings to the noun form, including a period of 40 days, several relating to ships, a state of enforced isolation, and as a restriction on the movement of people and goods which is intended to prevent the spread of disease or pests. The word is also used as a verb. Quarantine is distinct from medical isolation, in which those confirmed to be infected with a communicable disease are isolated from the healthy population. Quarantine may be used interchangeably with cordon sanitaire, and although the terms are related, cordon sanitaire refers to the restriction of movement of people into or out of a defined geographic area, such as a community, in order to prevent an infection from spreading. An early mention of isolation occurs in the biblical book of Leviticus, written in the 7th century BC or perhaps earlier, which describes the procedure for separating out people infected with the skin disease Zarath. The medical nature of this isolation is, however, disputed, as traditional exegesis sees it as a punishment for trespassing one of several negative commandments, most notably evil speech. A more recent hypothesis postulates that the infected are required to isolate themselves in order to prevent the spread of disease. Anyone with such a defiling disease must wear torn clothes, let their hair be unkempt, cover the lower part of their face and cry out, "Unclean, unclean." As long as they have the disease they remain unclean. They must live alone. They must live outside the camp. Ibn Sina also recommended quarantine for patients with infectious diseases, especially tuberculosis. The mandatory hospital quarantine of special groups of patients, including those with leprosy, started early in Islamic history. Between 706 and 707, the 6th Umayyad Caliph al-Walid I built the first hospital in Damascus and issued an order to isolate those infected with leprosy from other patients in the hospital. The practice of mandatory quarantine of leprosy in general hospitals continued until the year 1431, when the Ottomans built a leprosy hospital in Edirne. Incidents of quarantine occurred throughout the Muslim world, with evidence of voluntary community quarantine in some of these reported incidents. The first documented involuntary community quarantine was established by the Ottoman quarantine reform in 1838. The word quarantine originates from quarantena, the Venetian language form, meaning 40 days. This is due to the 40-day isolation of ships and people practiced as a measure of disease prevention related to the plague. Between 1348 and 1359, The Black Death wiped out an estimated 30% of Europe's population and a significant percentage of Asia's population. Such a disaster led governments to establish measures of containment to handle recurrent epidemics. A document from 1377 states that before entering the city-state of Ragusa in Dalmatia waiting to see whether the symptoms of Black Death would develop. In 1448 the Venetian Senate prolonged the waiting period to 40 days, thus giving birth to the term quarantine. The 40-day quarantine proved to be an effective formula for handling outbreaks of Th.